This is Dr. David Greene, CEO of the Texas Pain Network. Today's topic is what you need to know about acute and chronic back pain. Over 90% of Americans will experience back pain at some point in life. Regardless of whether or not treatment is sought, 90% of back pain gets better within 6 to 12 weeks. Unfortunately, that means 100% doesn't get better, and some will end up with chronic back pain. The definition of acute back pain is 6 weeks or less, subacute is 6 to 12 weeks, and chronic is when it's over 3 months. Back pain is the second most common reason for doctor visits, just behind the common cold. Half of all working Americans admit to having back pain each year. It's the most common cause of disability worldwide, and the cost of back pain, directly and indirectly altogether, is over $100 billion a year. So the most common cause of back pain is soft tissue injury, known as a back sprain or a back strain. This could be due to any number of things. It could be weekend warrior recreational activity. It could be moving your house. It could be something tiny like a sneeze, okay? But it involves injury to either the muscles, tendons, or ligaments of the back. Now when you start looking at the disc, this is a normal disc. It's a cartoon here. The outer layer is called the annulus fibrosus. The inner jelly layer is called the nucleus pulposus. Okay, it's a best analogy is that of a jelly donut. It's a very good shock absorber. 80% of the disc is actually water when it's healthy. Now here you can start to see degenerative disc disease, where you get loss of height because you're losing water. Okay, and it starts to bulge almost like a tire that's getting flat, and it can start pinching on things. And it can also irritate these outer layers. You get tears and cracks. Pain can result from that. There are nerve endings here, not here. Okay? So that's 40% of back pain comes from a disc problem, such as disc disease. Now, bulging discs are, as mentioned, when you start to have degenerative disc disease and the discs start to bulge out as it loses water and height, almost like a tire that's getting flat. Okay? Here you see a crack, tear in the outer layer of the annulus. That can cause back pain. If this fully tears and a piece squeezes out, it can pinch a nerve root and cause significant leg pain. Okay? Here's an example of sciatica. You have a disc that's bulging, so it doesn't have to actually herniate, but it's pinching a nerve root here, okay? And it can cause pain through the sciatic nerve, which just goes down the back of the leg or the side of the leg, and that can be really, really painful. Now, moving into the bony causes of back pain, far and away the most common cause is arthritis. The facet joints of the back are tiny, about the size of a thumbnail, but there's one on each side all the way from the neck down to the through the lumbar spine. All right? They're small joints. They can cause a lot of pain. The SI joints, there are two of them, left and right, and they connect the sacrum to the pelvis, known as the ilium. So it's sacrum, iliac, that's the SI joint, okay? They have cartilage and they can have arthritis just like other areas of the body, and the pain there is called sacroiliitis. And 12 to 25% of back pain comes from a problem in these joints. Now looking at scoliosis, scoliosis in adults is very different than scoliosis in kids. Scoliosis in kids is usually not painful. It's usually very flexible, so you put it into a brace and you may be able to prevent it from getting worse. In adults, it's a lot of times it's due to arthritis. All right, so here you have degenerative disc disease, then you start to get some arthritis in these joints on the left and the right, which are in the back here. This is from the front, and you start to get curvature, okay? This can cause back pain. It can also cause leg pain if you're pinching on nerves. Spondylolisthesis is typically due to spinal degeneration, and you start to get slippage of one vertebrae on another. Here you actually have slippage of this vertebrae on the sacrum, okay? Here, this, if it was L4 on L5, you'd have this one slipping forward on this one. And the more that it pulls, it can actually pull traction on nerve roots, so it can cause leg pain, buttock pain. The arthritis in and of itself can be painful. Spondylolysis is a fracture of this area called the pars. So you have the vertebrae, the disc, the spinous process, which is on the back of the spine, and then this is called the pars. So for people who are football players, gymnasts, it's a stress fracture where it can be very painful. And then spinal stenosis is when you have bony and soft tissue overgrowth due to arthritis around the joints of the spine, and it can actually pinch on the canal They can pinch on nerve roots as they try to get out, so you can often have a combination of back pain and leg pain. Uncommon causes of back pain would include tumor, infection, fracture. There are 700,000 vertebral compression fractures each year, so it's really not uncommon, but less so than the other ones we discussed. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurance plans and providing over 25 treatment options. There's over 90% success rates on average by the board-certified award-winning doctors. So visit us online today at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the Texas Pain Network. Your pain stops here.